Hey, you guys, Dr. Michelle Wolford here. I hesitated to join the COVID-19 bandwagon, but as a doctor and a doctor who treats patients globally, I felt it was my social and medical responsibility to offer factual information and support the health and well-being of my audience. Not just your physical health, but your mental and emotional health too, especially since we know that fear lowers immune system function. So my intention behind this talk is to share with you, from a place of compassion, understanding, and confidence, the facts about COVID-19. Immunology, ways to stay healthy, supportive treatments, risk factors, and of course, gentle reminders to keep living, because being afraid of living is death. Okay, so I just want to start with a general framework to give you guys an idea of what's going on here. So an outbreak happens when a disease occurs in greater numbers in a community than expected. And an epidemic is an outbreak that spreads rapidly to many people. A pandemic is an epidemic of global proportion that has become widespread through several countries and continents. So COVID-19 is currently a pandemic, but that's okay. It's to be taken seriously, but not to be feared. As an evolving organism, so you and me as humans, this is how our immune system matures and how we gain strength, internal defense, and immunity as a species. Of course, as a doctor who wants to be as informed as possible, I follow several sources to ensure you are getting the most accurate and up-to-date information. So I follow the World Health Organization, the CDC, Public Health Department for my local county, the European Center for Disease Prevention and Control, China's National Health Commission, and an independent data source maintained by Chinese physicians. I also see what our United States medical schools are doing from a research study standpoint. So I'm following Harvard and Johns Hopkins predominantly. So let me start by saying I am not afraid of the coronavirus. Yes, there's a subset of my patient population that I have flagged in my practice as at risk, and I'm keeping a close watch on these patients. But truth be told, I'm way more terrified by the smart meters and 5G that sit outside our homes that are controversially being placed all over the world, which science has shown that it is negatively impacting our immune health and leading to cancer and other immune dysfunction, actually making us more opportunistic hosts for pathogens like COVID-19. So I hope that you can glean factual information from this talk, action steps, and a peace of mind. So there are 4 aspects that I want to cover. There's the immunological aspect, there's health tips, the spiritual aspect, and the governmental aspect. Okay, so most of you have heard enough on the immunology, and unfortunately that is where I'm going to start, so you can skip ahead if you feel like you need to. But I would encourage you just to keep watching, because I have had a lot of patients come into my practice and ask me questions of things that they've heard around. And so there is a subset of falsities and fear-based rumors that are spreading around the virus that are circulating that are not true. And so it's my job to make sure that you are fully educated with factual information. And again, these organizations that I mentioned earlier, I am following them very closely and very tightly and making sure that the information I am giving to you is very factual based. Okay, so let's start with the immunological piece. Okay, COVID-19. So it's the name of the respiratory illness caused by the December 2019 outbreak of coronavirus in Wuhan, China. So coronavirus is a large family of viruses that are named for the spikes on their surface, and they look like crowns. So in Latin, corona means crown. It's thought to be spread by contaminated surfaces or respiratory droplets. The CDC has shared with us that the transmission of coronavirus from a surface to a person has not actually been documented. And the transmission of coronavirus occurs much more commonly through respiratory droplets than fomites, meaning surfaces, which is why they've recommended that we do social distancing of up to 6 feet, because it can be spread not by sitting in a room with somebody across the way that maybe has corona, but sitting close to somebody where you're spitting or hugging or kissing or so forth. So life science suggests that the virus can live on surfaces up to 72 hours. So the little bullet points from there is spread from respiratory droplets, lives on surfaces for up to 72 hours. Okay, so once it's contracted, the incubation period is said to be 2 to 14 days and only contagious during symptomatic expression. So the most common symptoms are fever and shortness of breath. Of course, any virus can express with any of these symptoms, and I think that's important to remember because there are patients that have gone in to be tested for COVID-19 and they've tested negative. And so I think that the awareness and the proactivity is great. And I just don't want people to be afraid of this virus. Like it's going to, I don't know, suffocate us all. So the reported symptoms thus far, so this is, I think, good to know, is fever. So younger children, extremely young children, like especially kids under 2, and really old patients, that's hard to, I guess, really classify and make a little bit more distinct, but we'll just go ahead and say patients over 75. Sometimes they don't spike fevers. Immunocompromised people have a hard time spiking a fever. So fever is a piece of it, but it's not always a telltale sign. Uncomplicated upper respiratory symptoms. So people are experiencing cough, sore throat, nasal congestion, difficulty breathing. So additional symptoms could be malaise, which is like a fatigue, headache, muscle aches, mild pneumonia. Severe pneumonia that comes specifically from COVID-19 has also been named SARI, and acute respiratory distress syndrome is also something that we are seeing in some patients, which is also known as ARDS. Sepsis, also not seen in a huge population, but that has showed up as a potential symptom. So that usually happens when somebody has an overreactive immune system and when somebody is releasing a lot of cytokines, which toxifies the body. And then death. This is very rare, but it has happened, and it will unfortunately continue to happen. So what we're working on is mitigating this by supporting our at-risk population. So the at-risk population is men and women over the age of 65 with underlying medical problems like chronic bronchitis, pneumonia, emphysema, COPD, heart failure, and in some cases, they think diabetes. So patients that smoke, whether that's cigarettes or marijuana, whether that's vaping or other illicit drugs, that damages the lung tissue. So that can put you at risk. Substance abuse lowers immunity, so that can put you at risk. And then, of course, if you are immunocompromised or in poor health, that can put you at risk. So there are no reported deaths in children to date. And pregnant women actually do not appear to be at great risk either. So there's a small study of 34 women in Wuhan, China, that are in their 3rd trimester of pregnancy, and they all were confirmed to be symptomatic for COVID-19 infection. None of them developed severe pneumonia or died. They all gave birth to healthy-appearing babies with normal APGAR scores, and there was no virus found in the amniotic fluid, the cord blood, or the breast milk. And again, all of this information I'm giving you is cited. So I'm assuming that death is what most people are afraid of because having an immune response, so getting sick, is just a natural response to new pathogens or bugs, and it's part of our maturing and evolving immune system. So Harvard Medical reminds us that as of March 15th of 2020, influenza has actually caused more deaths this flu season, both in the US and worldwide, than COVID-19. And I think that's important to remember. Of course, out of respect for the elderly with underlying medical complications and our immunocompromised patients, it is important to think about you as a vector, so a carrier, and not shift into fear regarding your own personal health and life. Fear breeds fear. So I don't know if you're familiar with mirror neurons. They're cells inside your brain that basically mirror what they see. So if they see sickness and fear of sickness and dwelling on sickness, it attracts sickness. We attract sickness, and we can create sickness. And fear, it changes the pH of our body, and it increases cortisol, which is our stress response, and it lowers our immune system function. So if we see health, if we stay focused on health, if we support our health, our cells mirror that response and they can stay healthy. It doesn't mean that you are immune and maybe won't contract the virus. It just means your experience of having the virus and the symptom expression will be very different. So let's take this opportunity to enhance our health and lifestyle practices, which I guarantee I'll get to here in a second. I just want to keep finishing with some of these public safety matters. So testing is available at your designated local CDC public health facility. Some doctors' offices have been able to acquire the COVID-19 testing kits. I'm still currently working with our local public health facility to get kits myself, but they are limited. And they're being reserved for patients that are symptomatic. And that is a county-wide thing. They will only swab people that they really think have the virus. And it's typically either a nasal swab or a mouth swab. So the California Department of Public Health urges that if a person develops symptoms of COVID-19, whether that's including fever, cough, or shortness of breath, and has reason to believe they may be exposed, they should call their healthcare provider or local department before seeking care. You can also call 211. Contacting them in advance will make sure that people can get the care they need without putting others at risk. So don't go rushing off to your doctor's office or the hospital to get tested at the first sign of a fever or a cough, unless, of course, your health is declining rapidly and you need urgent medical attention. So as my patient population knows, I, for over 10 years, have been seeing patients virtually. Granted, that wouldn't allow me to personally do a physical exam, but I could walk people through most physical exams. But there's a lot that we can do if you choose not to come into the office and you still need to be treated, or you want to refer to a family member that may be at risk. There's a lot you can do with CoronaVirus and Skype, and we can send supplements directly to you. So precautions to take. Disinfect surfaces, so doorknobs, buttons, countertops, washing clothes. Think about things like your cell phone, right? And your steering wheel of your car and your credit cards. So our hands touch so many things in a day. And so, maybe a good, general cleaning, I think, is of benefit. Washing your hands in hot water with soap for 20 seconds. The CDC recommends hand sanitizers. I personally, I'm not totally a fan. And the reason being is there's just been so much science that has actually showed us that kids that play in the dirt, kids that stick their hands in their mouth, kids that expose themselves to germs, kids that have animals, get their hands dirty, they've got a stronger gut microbiome, and they are less likely to develop autoimmune, whether as a child or later on in life, asthma, allergies, skin afflictions, and they're less prone to chronic sicknesses or repeated sicknesses or chronic disease. So I'll let you noodle on that one. Avoid putting your hands in your mouth. Wearing gloves. If you're in a public service, industry, I think wearing gloves is great, especially if you're dealing with like money or envelopes or goods that may be distributed through a lot of people. It's just a great way to try to mitigate any sort of extra exposure. Getting the flu shot will not prevent COVID-19. Irrigating your nose. So if you stick your finger in water and then put it in your mucous membranes, or, drinking water throughout the day is also very healthy and hydrating. It just keeps those mucous membranes hydrated, which is really, really great for our immune system health. A humidifier in the house with essential oils like Thieves or Breathe Easy or Purification Blend, that's great. And then, of course, we will get to the lifestyle, supplements, diet, and then my little health tips, I promise. I just wanted to answer some of these common questions that I have also been getting. So people are asking me questions like, is it safe to leave my home? Yes, being in nature, breathing fresh air, walking outside, it's very healing. If you are an at-risk population, just be aware of what you touch and who you're in close contact with. People are also asking me, is it safe to go to work and send my kids to school? Well, you may not have to answer this question for yourself. What I had been telling people is it's really personal to you and your health and your social network. Of course, the more people you are exposed to and the more places you go, the increase of risk of being exposed. If you are of the subset of the population that is at low risk, then I'm not concerned about exposure. We're going to be exposed at some point. The likelihood of you contracting it is going to be very high, and this is all about immune system maturation and development. Now, granted, if you are in the high-risk population, there's more of a concern. And of course, when there's low-risk and high-risk people that know each other, that low-risk person can be a vector for the high-risk person. So it's about being mindful. I don't think it's unsafe to go to work. I don't think it's unsafe for your kids to go to school. However, at the same time, we're watching things shut down, and everybody's being quarantined. So we may not have to answer this question for ourselves. Again, if you are of a healthy population, challenge, strengthen, educate your immune system. And again, of course, all of these precautions are really there to protect those who are at risk, and we want to value their health and their life. Just make conscious choices. So people are asking, do I need to wear a mask? No, the CDC does not find that it is helpful to wear a mask. People are asking, what do I do if I test positive? Well, you definitely want to notify your boss or anybody that you've been in close contact with. You definitely want to notify maybe the building, like let's say you work in a building, notifying the building manager, and allow each building manager and boss to decide how they want to handle that situation. I mean, the CDC is making recommendations that businesses put into action. And I do think it is your social responsibility to let people that you're going to be connected with that you tested positive. I mean, you can see that by 7 degrees of separation, we have all probably been exposed by now. And the CDC is asking that if you have any signs or symptoms, or let's say you live with somebody or have been in close contact with somebody with signs and symptoms, to self-quarantine, and that time frame is 2 weeks. But I also think it's important that people aren't afraid to like connect in with others and live and go outside. People are asking me if it's safe to travel, train, plane, boat. Again, the answer is personal to you. You know, the CDC would like people to cease all unnecessary travel and to avoid places of high contamination if you decide to travel, so that you can help lessen the spread. And some of these places the government has already closed to travel, so you may not have to answer that question for yourself and make that decision. Of course, I want to do my part in protecting and helping as many people as possible. And it's important for us to know that the virus will spread. Again, we will most likely come into contact with it at some point, and so I don't think it is to be feared at all. You know, there's a fine line between living your life in joy and making conscious decisions for the good of all. And that's why I think taking care of your health is so valuable. You know, that's why I do what I do. It's not just about today, it's about tomorrow. It's about the things that we can't control, the things that we don't expect, the things that you can't plan for. And so take control of your health, raise your vibration, and don't spread fear. And do play your part in mitigating your risk and the risk to others. So treatments, allopathic treatments, there are no vaccines or antivirals to date. Naturopathically, there's a lot of really, really great options. China has said that high doses of vitamin C are great. And then, of course, I've done a lot of research on supplements that I intuitively felt would be really, really awesome. And I've been able to find a lot of research that backs that up. Now, granted, none of the research is specific to COVID-19 because this is so new, but it is specific to other viruses that have a similar pathophysiology. And so to a degree that this is theory, but I do treat patients all over the world. And even though I haven't yet had anybody test positive in my physical practice, I have had people test positive outside of my physical practice. Okay, so let's talk about health. All right, so I just want to reiterate that we will all be exposed to COVID-19 at some point, and it is okay. It is an immune system upgrade, an evolution of self, and lower vibrational emotions such as fear and anxiety and panic and stress and worry and anger, they all lower your immune system function. This is a scientific fact, okay? And most people, they try to mitigate these stresses and these anxieties and boredom with turning to fulfilling substances like sugar or alcohol, which also compromises the immune system. So am I afraid of having a square of chocolate after dinner or a glass of wine? No, but I would refrain from many adult beverages and lots of homemade cookies. Okay, so let's talk a little bit about food. Eating organic, the less herbicides, the less pesticides, the less contaminants, the less chemicals on your food means less immune disruptors you'll be exposed to. So if there's ever a time, if you are ever resistant because it felt like a fad, I'm telling you, eating organic is very healthy and beneficial to your immune system function. Eating wild, grass-fed, free-range meats also means less hormones and less antibiotics that you will be exposed to in your meat sources. So the hormones, the exogenous hormones from our meat sources, they impact our hormones, right? So they're endocrine disruptors, and that negatively impacts our immune system, okay? The antibiotics that are given to animals and that residue that sits in the meat source, guess what it does? It actually strips our own gut microbiome of its natural immune defense. So do these herbicides and pesticides and contaminants. So knowing where you get your food, eating as clean as possible. If you have the ability to start a garden. So this is about getting back to the land. So food to gravitate towards to help keep you in balance. So I would say things like eating towards your temperament or your Chinese element or your Ayurvedic dosha. or your blood type. Those are really, really great ways to keep you in balance, and that's going to be personal to you. And if you haven't worked with a naturopathic doctor or a dietitian that does diet planning with those, I guess, different models of dietary suggestions, a good generalized rule of thumb would be have a mixture of meats and veggies and nuts and ground seeds and beans and fruits and fermented foods, bone broth, and then, of course, clean filtered water. And what you want to do is you want to drink your body weight in kilograms. That should be equal to the amount of ounces of water that you drink daily. So if you weigh 50 kilograms, that's 50 ounces. Now, if you're exercising, I usually say plus 15 to 45 ounces of water. Just something to think about. So the things that you want to limit and avoid would be inflammatory and mucus-producing foods. So that's going to be things like dairy, gluten, sugar, alcohol, coffee, peanuts, and soy. And I don't want you to all of a sudden become afraid of your food, but I just think it's important to have that level of awareness. So having a slice of cheese is most likely not going to kill you. However, it's the constant, it's cheese at every meal, gluten at every meal. It's just the chronic consumption or the overconsumption or the indulgence in these inflammatory foods that actually can affect and suppress and negatively impact our immune system. Okay, so some supplements. Now, granted, these are general recommendations, and this is kind of maintenance, right? So this isn't like I've contracted COVID-19, I think this is what you should take. This is general immune maintenance stuff, and in a time when we're being exposed to new bugs, I think it is important to just pay attention to your immune system function and to give it a little extra boost. So vitamin C. So kids under 2 years old, I typically recommend 100 milligrams. Kids under 12 years of age, 500 milligrams. And 12 years and up, 1,000 milligrams. If you're over 150 pounds, I would even say about 1,500 milligrams. Vitamin D, also a great immune nutrient. So 400 I use for kids under 2, 1,000 I use for kids under 12, and 2,000 I use for people over the age of 12. Now, let's say you've had lab work over the last 6 months and you show to be low in vitamin D, and I'm going to say low is anything below 39. I would increase it to 5,000 IUs and just do that daily. So zinc copper blends, these are super valuable as well. So zinc and copper, they compete for the same binding site. So if you're going to have zinc, have the copper. Zinc regulates the immune system, and copper actually is very antimicrobial. So for kids under the age of 7, I do 7 milligrams of zinc to 1 milligram of copper. And if you're over the age of 8, I do 15 milligrams of zinc to 2 milligrams of copper. Probiotics, this is not just a fad. In Chinese medicine, there's a distinct relationship between the colon and the lungs. So in our intestinal space, we've got the GALT system. And so this is where our immune system builds from a gut specific to immune tissue. In our lungs, we have the MALT system. So there's a distinct relationship from an immune standpoint and also from a Chinese medicine organ system relationship standpoint between the intestines and the lungs. So keeping your intestines clean, meaning watching what you eat, making sure you're having daily bowel movements, and daily probiotics can actually support the health of your lungs. And then, of course, immune support, so antivirals. And this is where natural medicine is just, it's amazing. So using antivirals like elderberry, black currant bud, sea buckthorn, black alder, these are all incredible herbs. So I would just encourage you to connect in with your naturopathic doctor and hear what they have to say about dosing recommendations, both in acute and maintenance cases. So any of my patients, any of you that are on steroids, immunosuppressants, chronic antibiotics, or maybe recent antibiotic use, I would definitely talk to your doctor about ways to boost your immunity because you have been on these things that suppress your immune system function and your natural defense. So it's going to be important that we can actually build up your own natural defense system. All right, daily habits. So these are great things in general, but this is what's going to keep you as a human organism as healthy and high vibrational. And if you could just think of like vibration as energy, right? So healthy, high energy, everything's in alignment, things are flowing, things are communicating well. So these are daily keep you in balance techniques. Okay, daily movement. So definitely moving your body for 20 plus minutes a day. and play, have fun, like have fun with it. And of course, you could do way over 20 minutes, but at least 20 minutes, even if it's just a walk around the block. Moving your body moves your lymphatic system. Your lymphatic system is the drainage pipes to everything that the body's trying to get rid of, break down, and say, take it out. So you want to be able to move that. We want to decongest the system with as much as possible so it stays focused on the situation at hand. Sleep routine. So if you're between the ages of 0 and 7, somewhere between 9 to 12 hours is great sleep. If you're between the ages of 8 and 18, somewhere between 8 to 12 hours is great sleep. And if you're over the age of 18, 7 to 9 hours is adequate sleep. And everybody needs a different amount of sleep. So I think if you're within the range, that's healthy for you. Okay, deep breathing. So I prefer that people close their eyes and do deep breathing for about 3 to 15 minutes a day. Of course, if you want to do longer, that's fine. So once you've closed your eyes for about 2 minutes, it actually recenters your whole neurological pathways, and it reduces cortisol, our stress hormone, and it helps our brain connect in with truth, with higher consciousness, and it helps silence the outside world. It changes our brainwave function. Again, scientific fact. So if we could do deep breathing exercises, and that could be anything from breathing your lungs out and back in, breathing them wide and back in. It could be plugging one side of your nostril and breathing in and then breathing out, and then breathing in that side and breathing out. It could be any type of deep breathing, but we want to oxygenate your body. We want to keep that lung tissue moving, vibrant, unsuspended by and bound by mucus, assuming that you have been exposed or you could be exposed by COVID. Some people even think that deep breathing is a type of meditation, and if it is for you, that's phenomenal. It's two birds, one stone, right? But I would also say if you could take 10 plus minutes a day to really transform your mental thoughts, especially around COVID. So it could be just your deep breathing. Maybe you just want to relax. Maybe you want to tune out the outside world. Or maybe you want to envision high vibrational living, happiness, where it is you want to go in life, what you want to achieve, what you want to connect in with. Maybe you visualize coming into contact with somebody that has COVID-19 and your body is so strong, it knows exactly what to do to take care of you. Power of the mind. Okay, laughing. Laughing is good. Do it as much as you can. Laughing is good. Being in nature daily. Do it. Get outside. Even if you live in a city, try to find a park, get your feet in the grass, connect in with nature. Sunshine. Daily is most ideal, 20 minutes. Of course, if you live somewhere where it's cold or it's rainy or the sun's just not out, whenever it peaks, just make that your priority. And, if it's cold, just bundle up, breathe some fresh air, get out in nature. Okay, Wi-Fi. Turn your Wi-Fi off at night. Wi-Fi is an electrical signal, and it disrupts our electrical body. And our electrical body likes to heal itself at night, but if it's getting disrupted by an electrical signal called Wi-Fi, then it affects the way our body heals and self-communicates. It's kind of like, I can't imagine sleeping in this room with this big bright light. It's not relaxing, it's not nourishing, it's not healing to my body. So Wi-Fi is kind of similar. And on that topic, I would say 1 hour max of TV and unnecessary electronic use daily. I mean, of course, there'll be days where there's more, and maybe there'll be days where there's less. I challenge you to try to get off the grid. I typically, Sundays, everything's off. Computer, phone, TV, that is my non-electronic day. Get out in nature. Connect in with people. The less amount of TV and electronics, the better. The blue light that comes off of this computer and your TV and your cell phones, it dysregulates your pituitary gland. And this is a gland that controls your sleep-wake cycles, your mood, and your hormones. And all of that governs your immune system function. Plus, our constant state of stimulation never allows our nervous system an opportunity to decompress and discharge information that it gets. So it's a great way to just silence the world, silence your internal world. And of course, I do question the quality of information images and impressions, our electrical visual world is telling our conscious and unconscious brain. Okay, so if you have contracted COVID-19, the same food principles apply. The only variation is that I would recommend dry, warmer foods. So adding in drier, warmer foods because it helps with lessening the thick mucus production that's happening in the lungs that are kind of coating themselves over the alveoli, which is where we do our oxygen exchange. So this will help with the breathing and facilitating oxygenation so you don't become hypoxic, meaning not getting enough oxygen. So dry, warm foods, according to Chinese medicine food principles, would be things like garlic, ginger, cinnamon, clove, pepper, cayenne pepper, walnuts, peppers, nutmeg, green onions. So eat. It's great if you don't have it, and it's great if you do have it. So just something to think about. As for the supplement dose that I recommended, I mean, that was very much a non-patient specific recommendation. I mean, I'm not recommending to anybody in specific. I'm just saying that's good general recommendations. So if you do contract COVID-19, or if you do want to see a specialist or a naturopathic doctor to ask specifically what they think your body needs based upon your past medical history and what's happening in your current life, I think that that is the smartest move. Because when people come to me and they think they've contracted COVID-19, I have different suggestions for different patients. I mean, sure, I can say blatantly, a blatant recommendation may be that vitamin C dose as your daily dose. I'm now, for the most part, recommending that that's happening every 4 to 6 hours, so they're getting mega doses. I'm not really shifting the vitamin D or the zinc copper blend. I'm still recommending daily probiotics. The immune support, those antivirals, I'm shifting the way in which I administer those. So maybe, again, it's in a dose every 4 to 6 hours. And then, of course, if there's any sort of lung concern, maybe somebody with a history of asthma or COPD or emphysema or cystic fibrosis, there may be herbs that are being used that I would use. I would just, again, this is not a recommendation for you. You must seek out your health advisor because certain herbs are better for certain people and certain bodies and certain temperaments. So I don't think it's safe to just loosely make recommendations. But herbs that I do love are things like mulleins and osha and lobelia. For patients that are sepsis or going into these cytotoxin storms, I'm using things like quercetin and nettles and curcumin and boswellia and lomatium. We're finding that it inhibits the NF-κB, which is a potential activator of inflammation and sepsis. And so there's a lot of science that's actually being done on these particular herbs to support these inflammatory markers. And so, again, it would be in your greatest interest to be under somebody's supervision and not just take things as you see fit or willy-nilly. And then, of course, your daily habits: sleep, 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 drink a lot of water, and then sleep, 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 more water, and go for walks, breathe, meditate, and sleep. And don't be afraid of a fever. That is your body's way of heating itself up and killing the bug and boosting your immunity and recalibrating itself. And the game is about being mindful. So, yeah, and don't plug yourself into a day full of TV when you're sick. It's not healing. Okay, so my last two topics, which are super important, so stick with me, is the spiritual component and then the governmental component. So spiritually, of course, I question, are we all being asked to slow down, to connect in deeper and align with our passion and our purpose and how we choose to contribute to society and our life? I do see this as an opportunity to raise our vibration, and that word means a lot to some people, and to others it just sounds super woo-woo. But it's kind of like when you're in sync with yourself, they say your vibration is higher. And what that means is like your energy capacity is greater. You feel lighter. You feel like you can rise above. You feel like your capacity is greater. And when your vibration is low, think about the times you've been angry or frustrated or in panic. There's so much energy going in all of these chaotically different directions that you feel fatigued, you don't have a lot of energy, and it's like everything just starts to kind of fall apart in front of you. So this is an opportunity to raise our vibration. Everything in life has a vibration, like a song, Be the song of health and healing and optimal living. Not fear, not death, not disease or sickness or pain or panic or suffering. The more alignment you are with yourself, the healthier your cells are, and the less room there is for a bug to invade and take over. This is an opportunity for us to focus on health manifestation and to strengthen our organism, to gain congruency within, to allow each cell to tick together in rhythm versus those opposing beats creating that inner turmoil and chaos, which we know weakens a cell. So I read this amazing quote and I want to share it. And I just think it's of value. So there was a gentleman, Rudolf Steiner, back in 1917, so over 100 years ago. And this is what he said, and I just find this very interesting. He said, in times when there were no electrical currents, when the air was not swarming with electrical influences, it was easier to be human. For this reason, in order to be human at all today, 1917, it is necessary to expand much stronger spiritual capacities. So this was written in 1917. And you can only imagine how much our world has changed in the last 100 years and how much more we are bombarded by electrical influences. So we are being challenged. A happy, healthy cell, let's just say it vibrates like this, okay? And all of these electrical influences, it is very irritating to the cell. It disrupts it, it knocks it off rhythm. And so to gain spiritual capacities means that you are doing things internally to re-rhythmatize yourself in your cell so that you can be your superhuman self and not be as negatively impacted or influenced or bombarded by these electrical influences. Because these electrical influences that are destabilizing our cells are making us more opportunistic. So, of course, the question comes in my mind, is corona a diversion from 5G, the smart meters that are putting a huge electrical pulse all over the world? Or is this a sequelae of the 5G? All I'm suggesting is stay eyes wide open. Let's not get hyper-focused on COVID-19 and lose focus of all of the other things that we have been focusing on, the other controversial governmental matters. 5G has medically been shown to increase the risk of cancer and affect how a cell thrives and vibrates. And with 5G smart meters all over the world, close to our homes, close to our kids' schools, our physiology is challenged and we become more opportunistic for bugs like COVID-19. So keep fighting for your human rights the way you did before COVID-19. And, you know, a lot of people are asking, gosh, these closures and the quarantining, and I think that people, it's stimulating fear, right? So don't let your fear match these drastic measures. We are doing this from a public health safety standpoint and to lower the risk of contraction, but it's really to be able to support the healthcare system, because if everybody gets sick at once, people will be turned away. And so this is a way to control the spread, to lessen the time in which people get it. We will most likely all be exposed and most likely all get it, but this is to control who and what gets it, when and where. And I guess lastly, I just want to thank Dean Koontz. One day I'd love to talk to this man because I want to know, did you channel this information? Did you sit on some UN governmental meeting, or is somebody copycatting you? Because he wrote a book back in 1981, so 38 years ago, and he happened to talk about this virus from Wuhan, China, that was going to be released in 2020 that attacks adults and not kids, but it makes kids psychic. So if it makes me psychic, I'm excited. Anyways, I hope you guys enjoyed the talk. I know it's a lot of information. I know we're constantly being bombarded by information, but I really wanted to present to you factual information. Like I said, these are from the CDC, from WHO, from Harvard, from the European Disease or Center for Disease and Control, from China, from all sorts of PubMed articles. So what you heard here today is factual information, and I just want to support your mental health, because I don't think that this is to be feared. I think this is to be met, quite honestly. And I think that it really starts from within. So, you know, be responsible, be respectful of others, be conscious of the fact that you may be a vector. Take care of your immune health. take ownership of the healthy things that you do in your life. Let's start to eliminate some of those unhealthy behaviors. But most of all, like, you got to live life, because as humans, the one thing we've always had is movement and freedom. And to stifle movement and freedom, I question what that would do to somebody's health. So I hope you enjoyed it, and I guess I will see you guys around.